This presentation is on simplex herpes, which is commonly referred to as a cold sore. There are two main types of simplex herpes. The first one is HSV1, also known as oral herpes. The signs and symptoms can last anywhere from 2 to 3 weeks. Tingling, itching, or burning can occur at the infected area before the sores are even visible. The sores are bumps that turn into blisters. These sores can develop on the lips, inside the mouth, and can even spread down the chin and neck. You may also experience flu-like symptoms, such as headache, fever, muscle aches, and soreness. HSV1 is transmitted through oral discharge or the sores on the skin. It can be spread by kissing, sharing utensils, or even lip balm. HSV2 is also known as genital herpes. This is one of the most common sexually transmitted diseases. You will notice there are some similar signs and symptoms between oral and genital herpes. The signs and symptoms for genital herpes can last anywhere from 2 to 6 weeks. Tingling, itching, or burning can occur at the infected area before the sores are even visible. The sores start as small blisters and eventually break open, causing them to be very painful. These sores can develop on the genitals or on the skin around the area. You may also experience flu-like symptoms such as headache, fever, muscle aches, and soreness. Problems urinating could be caused by blisters being on the genitals, which lead to discomfort and pain when trying to urinate. HSV2 can only be transmitted through sexual intercourse with another person who has genital herpes. Always remember that oral and genital herpes can spread even if the sores are not visible.
According to the City of Ottawa guidelines and regulations, things to look out for with regards to HSV2, also known as genital herpes, are painful sores on the skin and around the genitalia. The sores may be accompanied by a fever, flu-like symptoms, or even painful urination. Educators do not need to exclude children from the program if the child shows any signs or symptoms of HSV2 herpes, as it can only be transmitted through sexual contact. Educators also do not have to report any of the cases either.
How to prevent at Early Learning Center. In order to prevent the infection and spread of simplex herpes in an early learning environment, some steps that should be taken include: educators should be aware of the signs and symptoms mentioned in previous slides. Toys, eating utensils, and anything else that comes into contact with the mouth should be properly sanitized. Changing stations should be properly and regularly sanitized. Educators should take precaution in making sure they keep themselves safe by washing hands, wearing gloves, and keeping themselves sanitary. Children should also wear sunscreen when taken outside because UV lights can trigger a recurring infection. What does the center do if children contract herpes? Some steps that should be taken if a child in an early learning environment contracts herpes include monitoring the sick child's use of toys and utensils and not allowing the sharing of these objects. Educators should administer medication only if prescribed by a doctor and provided by parents, following all dosage information. Wearing gloves while changing and also touching any sores, for example, while washing faces. And including the children in all activities, regardless of their diagnosis.
What parents and caregivers can do if the child has an infection. Most cases of simplex herpes, also known as cold sores, can be treated from home. Severe herpes infections, such as those affecting newborns or the brain, will require hospitalization and intensive care. During a cold sore outbreak, it is important to keep your child from scratching or picking at the cold sore. Avoid foods and drinks that are very acidic. To prevent dehydration, make sure the child is receiving lots of fluids throughout the day. And if your child shows signs and symptoms of the first herpes infection, call your pediatrician. If your child has a fever, swollen glands, or trouble eating because of mouth sores, your pediatrician may advise an office visit. An antiviral medication can be given to help speed the healing process. If your newborn develops a rash, fever, or irritation of the eyelids or eyes in the first month of life, call your pediatrician at once. Health organizations in your local area may also be able to help to offer some guidance.